Hello and welcome to another episode of your AKT Podcast, which is hosted by WellMedic.co.uk. In this podcast, you have the same adult patient who again has recently been discharged following acute coronary syndrome. Which lifestyle interventions should take place for this patient? Feel free to pause the pod and jot some answers down. So the answer to this question can be found in the nice visual summary for cardiac rehab and secondary prevention for ACS. Cardiac rehab should be offered before hospital discharge, and an assessment should take place in 10 days from discharge. The program should feature physical activity based on their clinical condition, lifestyle advice, stress management, and health education. So in terms of specific lifestyle factors, you should offer them a healthy eating diet based on Mediterranean diet. Without being a food connoisseur, this would be a diet based on vegetable and fish. Alcohol should be within the recommended units of 14, and regular daily exercise should take place to the point of slight breathlessness, which would be around 20 to 30 minutes per day. So although this podcast is focused on the very basic and general advice following acute coronary syndrome, you should also consider some of the patient's specific areas. Now, what I don't want to do is give you all the information. I think it's really important that you go and have a look at some of the primary resources. So some things to consider or some things to take away from this podcast is have a look at driving restrictions for patients with ACS, whether that's with or without PCI intervention. Think about the same for flying restrictions as well. Think about what advice you may give to a patient for sexual activity following ACS, and also consider the impact of GTN use and the impact of erectile dysfunction when a patient has had ACS and they're on medications such as isosorbide mononitrate. So I hope you found this scenario helpful. I hope I've covered some interesting points and some areas that you may be able to read about, which will only boost your AKT revision preparation. So one final point before we end this podcast: WellMedic has our AKT mock course, which features 200 questions with thorough explanations as well as hundreds of new learning points. So please do visit wellmedic.co.uk and please share this with your GP trainee colleagues. This podcast is hosted by wellmedic.co.uk. We help GP trainees pass the AKT.